Oh, what's going on, world? Hey, you already know the deal. Today is Tuesday, going hard in the paint. Today's the 5th of December. You already know what we're going to do. We're going to do NCLEX questions. Hey, y'all keep showing up. I'm going to keep showing up. Y'all keep showing out. Well, y'all already know what the deal is. Your boy's going to show out. So you guys already know the deal. For all those that are jumping in, welcome. We are about to do NCLEX questions. Make sure you guys share. Make sure you guys follow. And make sure you guys give it a like. Hey, share, follow, smash that like button. Those are the three things. Those are the three things that your boy needs to get it out to people, okay? Hey, once we get 100 folks up in here, you guys already know what the deal. But, hey, we're going to do NCLEX questions. Hopefully everybody had a good day, good night last night. And there was something that was of value for you guys. So I hope everybody's appreciating that. I see Bella up in here. Hannah, that name looked familiar. Jamie, that looked different. Okay. All right. So you already know the deal. I got these questions off nurseslabs.com. Once you guys get up in here, we're going to do them. It says, Bella said, I passed Nursing 101 by the skin of my teeth. That Hesse rocked me. Hey, that's all right, though. Hey, a pass is a pass. Thunder, what is up? You're here on a Tuesday, Thunder. So for the last 2 weeks, I've been doing everything. I've been doing it, Monday through Friday, so people ask me, hey, can I do it every day? So I'll do it every day until I don't, and I'll go back to three times a week. And if this is beneficial, but it all just depends on how the streams go. So, right. Yesterday, I think I had about 45 people in here, but on Friday I had 400 or 500, I think max of 700 or 800. So, hey, the more people, the better. My instructor didn't like that I said C's get degrees. Bella, so here's the thing is sometimes you got to know when to keep your mouth closed. All right. Sometimes you got to know when to keep your mouth closed. You know what I'm saying? Right. Because you don't want people to railroad you. Although what you're saying is the truth. All right. So, you'll start to build your experience once you start to get into the nursing realm and once you start to get out there. But don't do that to yourself, because people try to gatekeep and they try to gatekeep and they try to hold that up here. So don't let these people in the position of power, mess with you like that. Hey, but we got 100 folks up in here. You guys already know the deal. You already know where we going. We about to do questions. Army nurse, baby. I'm glad that you're here. I appreciate you. Hey, so you guys know the deal. We're going to do NCLEX questions. Participate. Give me likes, shares, follows. Hey, we need 10,000 likes, y'all. So don't be selfish your whole life. Hey, don't act up or I'm going to ban you. Nurseslabs.com is where I got these from. 7-day NCLEX course. Hey, you need tutoring, coaching, that ebook. All those links are in my bio. We're going to do an Ask Me Anything after this. I failed my Hesse by 2 points. I'll get it next time. I know that's right. Here we go. Question number 1. Mr. Rodriguez is admitted with severe pain in the knees. Which form of arthritis is characterized by urate deposits and joint pain, usually in the feet and legs, and occurs primarily in men over the age of 30? Is it septic arthritis, traumatic arthritis, intermittent arthritis, or goity arthritis? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurseslabs.com. So these are for both RN and LPN. So if that is what you are going for, this is for you. All right. Also, I want to know who you are, where you're from, and where you are at in your nursing journey. All right. Let us know. And also, if you're not a nurse, what you doing here hanging out with us? They call that, did I say goity or gouty? Not goity. It says, I hope I haven't been pronounced. Hey, who cares? Here's the thing. I don't care if you pronounce it wrong, right? If you can let me know what it is, that's all I care about. Gouty arthritis. Hey, if I say it wrong, that's cool. No part of me cares. Do I look like a 10-year-old getting ready for a spelling bee? If I say it wrong, I say it wrong. In South Dakota, doing an online nursing program at Nightingale College halfway through. Hey, shout out to you, DK. What part of South Dakota? I was just in Rapid, South Dakota not too long ago, and I enjoyed it up there. So here we go. During the summertime. Here we go. Here's our answer in 3, 2. And the answer is D, gouty arthritis. Gouty arthritis, a metabolic disease, is characterized by urate deposits and pain in the joints, especially those in the feet and legs. Urate deposits don't occur in septic or traumatic arthritis. This is part of physiological adaptation, which is the third largest section on the NCLEX exam. All right. Third largest section on the NCLEX exam at 11 to 17%. Rapid City. Yeah, I like Rapid. I like Rapid City. I was up there with the South Dakota National Guard. We were doing an exercise up there. I did it this year and last year, and it was fun. I feel like if you go to South Dakota, that's one place that you can hide. Like you can hide out in the Black Hills and stuff. So here we go. Question number 2. A heparin infusion at 1,500 units per hour is ordered for a 64-year-old client with stroke in evolution. The infusion contains 25,000 units of heparin and 500 mLs of saline solution. How many mLs per hour should be given? All right. Is it 15, 30, 45, or 50 mLs an hour? You finally made it at 5:30, man. That's what I'm talking about. Hey, Nightingale, buddy. Trying to pass with 246 Hesse. What? 246 is what I failed by 2 points. Hey, it happens. It happens, y'all. It happens. Hey, so if you guys are new here, welcome. Hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. That is the trifecta that TikTok needs to get it out to those people. If you're still in nursing school, you need to be sharing this to your cohort. You know what I'm saying? Don't be selfish out here. You know what I'm saying? Get it out to those people. All right. BSN 240 in health assessment. Okay. Or 246. I got you. All right, y'all. I'll give y'all a little bit more time. What are we thinking? Give me some answers. I know y'all are trying to figure out the math, but what are they? Hey, what's the answer? Hannah says B. Okay. All right. B30. Okay. Is it Mame? Is it Mame or like how do you say is it give me a thumbs up if it's Mame. I feel like that's what it is. Army Nurse says B. Steph says B. All right, y'all. Here we go. Yes, Kev. Yeah. All right, cool. I got it right. All right, here we go. Here's our answer in 3, 2, and the answer is B. 30 mLs. An infusion prepared with 25,000 units of heparin in a 500 ml of saline solution yields 50 units of heparin per ml of solution. The equation is set up as 50 units times the unknown quantity, right, which equals 15 mLs per unit, which is X equals 30 mLs per hour. Okay, so pharmacological and parenteral therapies. Hey, you could have 1 to 2, 3 or 4 dosage calculations on your exam. Okay. All right, so be prepared. Hey, be prepared for that. Also, if you're in school, you better be doing dosage calculation and all that in pharmacology. There you go. 50 divided by, or 500 divided by 50. Easy. Is it Denisha? Yeah, easy. Easy monies right there, right? Here we go. Question number 3. A 76-year-old male client had a thromboembolic right stroke. His left arm is swollen. Which of the following conditions may cause swelling after a stroke? Is it elbow contracture secondary to spasticity? Is it loss of muscle contraction decreasing venous return? Is it a DVT due to immobility of the, the ipsilateral side? Or is it hypoalbuminemia due to protein escape from an inflamed glomerulus? I always mess that up. You know what I'm saying? Hey, but shout out to all y'all, all 28 of y'all. So what is the answer, y'all? What are we thinking? I'm gonna give y'all 15 seconds, 20 seconds. Now 15 seconds. Hey, if you guys are new here, welcome. Make sure you guys smash that like button. Trying to get to 20,000 likes, or 10,000 likes, and then we'll go to 20, and then we'll see how it goes. All right, make sure you guys like, share, follow. Hey, don't be selfish your whole life. You know what I'm saying? Get carpal tunnel for me. All right, make it happen. If you guys are new here, we're doing NCLEX questions. Got them off of nurseslabs.com. Nurseslabs.com. All right. Free sets of questions. Make sure you guys go over there and check those out for yourself. Okay. A little bit about me. I've been a nurse for 3.5 years. I worked in 3 ICUs. I've worked in PACU and I've worked in OR. All right. So that's just a little bit about me. I'll tell y'all about me as we keep going, but I want to know about y'all. Rach says C. What's up, Rach? I didn't even see you jump in here. Here we go, y'all. Here's our answer in 3, 2. And the answer is B. Loss of muscle contraction decreasing venous return. In clients with hemiplasia or hemiparesis, loss of muscle contraction decreases venous return and may cause swelling of the affected extremity, which is physiological adaptation, the third largest section on the NCLEX at 11 to 17%. All right. Part of the big 3, you got pharmacology, physiological adaptation, and management of care. And if you're an LPN going for that exam, it is coordinated care that takes off of for management of care, but essentially it's the same exact thing. Okay. Here we go. Question number 4. Heberden's nodes are common signs of osteoarthritis. Which of the following statements is correct about this deformity, right? Only in men. Appears on the distal phalangeal joint, appears on the proximal interphalangeal joint, or appears on the dorsolateral aspect of the interphalangeal joint. What are we thinking? Hey, and it's cool. If you don't know, that's okay. I would rather you guess. You have a 25% chance of getting it right than just not guessing at all. All right. And on NCLEX, you don't have a choice. You know, you gotta answer it. You know what I'm saying? You gotta give them an answer. All right. Never heard of that, but maybe B. Okay. Got you. Heberden's high. So distal. Okay. All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. What's up, Sky? How are you? Hey, if you guys are new here, we're doing NCLEX questions, got them off nurseslabs.com. Also, I want to know, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. All right, and if you're not a nurse, what you doing here? B, this was actually on my HESI. Nice, okay, here we go. Here's our answer in 3, 2, and the answer is B. It appears on the distal interphalangeal joint. Heberden's nodes appears on both men and women, okay? And the distal interphalangeal joint, that's part of physiological adaptation. Hey, this is one of those questions that they would ask you if you were doing really well on the exam. Not everybody's going to know what that is, right? But I do expect for you to know what everybody else knows, but not everybody's going to know what this is. You know what I mean? So make sure you guys, when you guys are doing your questions and answers and you're reading your rationales, if you don't know, do some little bit more research. That's why content is there, okay? Number 5, which of the following statements explains the main difference between rheumatoid arthritis and osteoarthritis? Osteoarthritis is gender specific. Rheumatoid arthritis isn't. Osteoarthritis is a localized disease. Rheumatoid arthritis is a systemic. Osteoarthritis is a systemic disease and rheumatoid arthritis is localized, or osteoarthritis has dislocations and subluxations and rheumatoid arthritis doesn't. What are we thinking? Shout out to all 40 of y'all. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. Get it out there. That is what TikTok wants. It is the trifecta to get it out to folks. OK, like, share, follow. All right. Let me fix this. Make sure that this isn't muffled up because I know this starts to get muffled. There we go. All right. Oh, also about me, I've been in the Navy for 16 years. I am enlisted. I was a surgical tech. Well, I am a surgical tech as well as a master instructor in the Navy. So been doing this teaching for the last 8 years, taught in the surgical technology program as well as other programs. Currently a trauma nurse instructor as well. So, got a lot of teaching behind me and got a lot of medicine and aspects, especially in the surgical realm, to, kind of give to y'all. So I appreciate everybody being here. But here's our answer. Here's our answer in 3, 2, and the answer is B. Right? Osteoarthritis is a localized disease while rheumatoid arthritis is systemic. All right? That is part of physiological adaptation. Hey, shout out to you, Rach. Physiological adaptation, third largest section on the NCLEX exam. At what? 11 to 17%? That's what I'm talking about. Anticoagulant, you got it. You got it. Hey, real quick, if you guys are new here, welcome. We're doing NCLEX questions for both RNs and LPNs. Participate. I'm kind of funny. I'm going kind of fast. You know what I'm saying? But participation is the key, baby. Make it happen. Hey, share, follow. Give me all those likes. Don't be selfish your whole life. All right. Hey, if you come into my chat and you act up, I'm going to ban that ass. So don't be rude. All right. Nurseslabs.com is where I got these questions from. 7-day NCLEX course. Hey, lifetime access and all the updates. Hey, you guys get it all. Also, there's a free download on the website. If you need coaching, tutoring, ebook, all that stuff, that link is also in my bio. All right. Good evening, friends. What's up, Aaron? How are you? Here we go. Question number 6. Mrs. Cruz uses a cane for assistance in walking. Which of the following statements is true about the cane or other assistive devices? All right. Is it A walker is better? A walker is a better choice than a cane. The cane should be used on the affected leg. The cane should be used on the unaffected leg. Or is it D, a client with osteoarthritis should be encouraged to ambulate without the cane? All right. Hey, so sometimes it's that easy. There are two that just aren't going to make any sense when it comes to multiple choice. So now which one are you going to pick? Right. Everybody's saying C. Okay. All right. What else you got? Anybody else? Hey, we're on the road to 10,000 likes, baby. 10,000 likes. Appreciate everybody being here. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. Nurseslabs.com is where I got these questions from. Free questions. Also, if you're a nursing student, they have care plans, care plans to help you out. Trust and believe me. I used them when I was in school as well, and they were beyond helpful. All right. And the answer is C. The cane should be used on the unaffected side. A client with osteoarthritis should be encouraged to ambulate with a cane, walker, or other assistive device as needed. Their use takes weight and stress off of joints. Okay, that is part of basic care and comfort, which is 6 to 12% on the NCLEX. A little bit of smaller section, but still very much important because those are the sections that can literally put you over the top. Okay, here we go. Question number 7. A male client with type 1 diabetes is scheduled to receive 30 units of 70/30 insulin. There is no 70/30 insulin available. As substitution, the nurse may give the client what? Is it 9 units of regular insulin and 21 units of neutral protamine or NPH? We'll just go to NPH. Is it 21 units of regular insulin and 9 units of NPH? Is it 10 regular insulin, 20 of NPH, or is it 20 of regular insulin and 10 of NPH? What are we thinking? What are we thinking? Shout out to all 40 of y'all in here rocking with me. We're doing NCLEX questions. If you guys are new here, welcome. Make sure you guys share, smash that like button, and make sure you guys follow. All right. Doing questions every day to every other day. You know what I'm saying? Make sure you guys share to those people that are in your cohort, that you find this important. Or if you're a nurse, cool, whatever. Trying to remember some things, because ain't nothing wrong with a refresher. You know what I mean? So, all right, 10 seconds, y'all. Natasha says B. Okay. Hannah says B. Is it Jine or Jean? Says B. Okay. B or D. Bree, you got to give me one. Give me one, Bree. Give me one. Got to give me one. All right. Is it Gazania? Gazania says B. This one is hard. Okay. Hey, what's up, Monisa? Hey, y'all. Monisa's here, y'all. Monisa's here. One of the homies. All right, one of the homies. And the answer is A, 9 units of regular insulin and 21 units of MPH. A 70-30 insulin preparation is 70% MPH and 30% of regular insulin. Therefore, a correct substitution requires mixing 21 units of MPH and 9 of regular insulin. That is pharmacology, pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 14 to 18%. Second largest section. Okay. What's up, Karam? Hey, Karam's always here. Get that license and you still come back. You know what that's called? Giving back. And that's what I like to see. I appreciate you being here. All right. Oh, I didn't know this. Hey, that's okay, Rach. Now you do. You know what I'm saying? So now it looks familiar to you. You know what I mean? It's like, wow, I was my instinct. I bet. Here, question number 8. Nurse Lynn should expect to administer which medication to a client with gout? Is it aspirin, Lasix? Oh my God. Is it colchicine or is it calcinate? I always mess that up. Anyways, so I'm pretty sure somebody's going to correct me like, Kevin, this isn't how you say it. And I'm going to be like, you're right. That's how you say it. But it's not how I'm going to say it. You know what I'm saying? Hey, I appreciate all y'all. Make sure y'all smash that like button. Get carpal tunnel for me. Hey, Monica, since you're here, hey, smash that like button right now. You already know the deal. We need 10,000 likes, baby. Make sure you guys share. Make sure you guys follow. Also, what do you do here? Like, what are you doing? Where you from? You know what I'm saying? Anybody see that GTA trailer? I'm just saying, you know what I mean? 10 seconds, y'all. Monisa, I appreciate you. Hey, so, hey, my homie, Monisa, I want to let y'all know, hey, I coached her, y'all. I coached her, for her to help her with NCLEX, and now she's one of my moderators, one of my homies. Now Miss Thing over there got a master's degree, charging, you know what I'm saying? Just took her clinical nurse leader, about to be running shit. So everybody right now, y'all give Monisa some love, you know what I'm saying? The homie has come a long way, and she knows that she's great. So I'm just letting y'all know. And the answer is C, colchicine, a disease characterized by joint inflammation, gout, right, is caused by uric crystal deposits in the joints. All right, the physician prescribes colchicine to reduce these deposits and thus eases joint inflammation. Also, pharmacological and parenteral therapy, second largest section on the NCLEX exam. All right. He said, all right, Queen, that's what I'm talking about. Hey, Mona's out here doing it big. You know what I'm saying? Here we go. Question number 9. Mr. Domingo, with a history of hypertension, is diagnosed with primary hyperaldosteronism. This diagnosis indicates that the client's hypertension is caused by excessive hormone secretion from which of the following glands? Is it your adrenal cortex, your pancreas, adrenal medulla, or parathyroid? What are we thinking? LPN looking to get RN. Hey, who said that? All about Tia 83. Hey, so are we going to get in one? Are we going to get in the program? You know what I'm saying? Jonah says, Kevin says, you the man for these lives. You already know what the deal is. I do these all the time and I do them for y'all. You know what I'm saying? So I appreciate y'all being here. All right. So what are we thinking? We got some A's. We got some D's. Rach says A. Okay, Rach. All right. Mommy says A. Okay. What else we got? Hey, shout out to everybody that's just now joining. We're doing NCLEX questions. I'm accepted. Just need to get classes. Okay. So shout out to you for getting into your RN program. Virgo, baby. I don't know about all that. You know what I'm saying? Scorpio season, all year. You know what I'm saying? That's my toxic trait, is that it's Scorpio season all year. You know what I'm saying? But no, congratulations to you. All right, here we go. And the answer is A, adrenal cortex. Excessive secretion of aldosterone in the adrenal cortex is responsible for the client's hypertension. This hormone acts on the renal tubule, where it promotes reabsorption of sodium and excretion of potassium and hydrogen ions. That is part of physiological adaptation. Third largest section on the NCLEX exam, y'all. Third largest section on the NCLEX exam at 11 to 17%. All right. Hey, get this knowledge in. You know what I'm saying? You never know. You never know when it'll come in handy or if it's just good for you to know. You know what I mean? Here we go. Question number 10. For a diabetic male client with a foot ulcer, the doctor orders bed rest, a wet to dry dressing change every shift, and blood glucose monitoring before meals and bedtime. Why are wet to dry dressings used for this client? They contain exudate and provides a moist wound environment. They protect the wound from mechanical trauma and promote healing. They debride the wound and promote healing by secondary intentions, or they prevent the entrance of microorganisms and minimize wound discomfort. What are we thinking? What are we thinking? Shout out to everybody for them likes. Started studying the NCLEX for now. Okay. Hey, so that's actually a good point. Karen makes up a good point. Is that you can start studying for NCLEX now, but you know you already an LPN, so now you just need to understand what your different roles are. Right now you're going to be an RN. Now you realize that you can delegate. You can understand evaluation, doing first assessments, all that good stuff. All right. Hey, and of course, if you got an NCLEX course, hey, I got one. $97. You guys can check that out. That is linked in my bio. I had something like this for remediation. Okay, Hannah. Well, hey, now you're getting double the remediation. You know what I mean? Here we go. Here's our answer, y'all. Here is our answer in 3, 2, and the answer is C. They debride the wound and promote healing by secondary intention. For this client, wet to dry dressings are most appropriate because they clean the foot ulcer by debriding exudates and necrotic tissue, thus promoting healing by secondary intentions, right? This is part of health promotions and maintenance. Is this for fundamentals RN HESI? No, this is just a comprehensive exam that's for NCLEX. But I mean, it's still helpful if you're doing HESI. Okay. Hey, real quick, we're doing NCLEX questions. Speaking of that, for RNs and LPNs, make sure you guys participate. Give me all them likes. Give me all them shares. Give me all them follows. You know what I'm saying? Is it Denicia? I appreciate it. I'm glad that you find that this is helpful. Hey, make sure you share and make sure you follow, okay? Don't troll my chat. If you troll my chat, I'm going to ban that ass. Literally, it says that I'm going to ban that ass, okay? Nurseslabs.com is where I got these questions from. So, hey, if you're in fundamentals, hey, go over there and look at it. They got some fundamentals questions over there. Hey, 7-day NCLEX course. Hey, if you get it, it's yours forever. And I mean forever to where if something happens to you, you can pass it to your descendants like a, I don't know what the hell, y'all know what I'm talking about, where you pass it down. Tutoring, coaching. Also, if you need an ebook, I got an ebook out there too, y'all. Y'all can check those links out there in my bio. Also, I'm going to do an Ask Me Anything to follow after this, okay? So make sure you guys stay tuned and hang out. Nurse Zinni is caring for a client in an acute Addisonian crisis. Which laboratory data would the nurse expect to find? Is it hyperkalemia? Is it a reduced BUN or blood urea nitrogen? Is it hypernatremia or hyperglycemia? What are we thinking? Shout out to all 51 of y'all in here. Make sure you guys smash that like button. Hey, we're on the road to 20,000 likes, y'all. We're on the road to 20,000 likes. Make sure you guys share. Make sure you guys follow. And make sure you guys smash that like button. Is it Nevi? Nate, is it Nevi? Let me know. Hi, is it Nevi, Nevi, Levi, Navi? Let me know. I'm pretty sure I just gave you too many choices, and so you won't be able to narrow it down, but I appreciate you. Neve. Oh, okay. Got you. Did I say that right? Neve? All right, we got C's, we got B's, we got D's. Mimi's Spark says it. Whoops, he said A. Hey, RTFQ. Hey, what does RTFQ mean, y'all? Hey, if you're a normal person that comes here, y'all let me know. Here we go, y'all. Here's our answer in 3, 2, and the answer is A. Hyperkalemia. In adrenal insufficiency, the client has hyperkalemia due to reduced aldosterone secretion, right? That is reduction of risk potential. Nevea. Oh, Nevea. Okay, Nevea. I got you. Woo woo. Hey, shout out to you. Is it Brish? Shout out to you. All right, Nevea. I got you. on pronouncing it right. All right, here we go. Question number 12. A client is admitted for treatment of SIADH. Which nursing intervention is appropriate? Do I want to infuse IV fluids rapidly as ordered? Do I want to encourage increased oral intake, restricting fluids, or do I want to administer glucose-containing IV fluid as ordered? It's Bree. All right, I'll just call you Bree then. But there's a lot of Brees that come in here, so I might just be like Bree with an X. You know what I'm saying? Just to separate y'all. I got a couple of Brees that pop up in here. What's up? Was it Butter? Okay, 11 to 17%. All right, so make sure you guys are going through all. When you're doing your NCLEX prep, you are doing content, you're doing questions with answers, and you are reading your rationales. That is how. Those are the three things that solidify that knowledge. All right, so you're able to retain it. Question 13: a female client tells Nurse Nikki that she has been working hard for the last 3 months to control her type 2 diabetes mellitus with diet and exercise. To determine the effectiveness of the client's efforts, the nurse should check what? Is it urine glucose levels, fasting glucose, blood glucose levels? Is it the serum fructosamines levels, or is it the glycosylate, the hemoglobin level? Obviously, I don't know how to speak, but whatever. Y'all don't judge me on speaking. You know what I'm saying? I'll ban that ass. You know what I'm saying? I'm letting y'all know. You know what I'm saying? Hey, welcome. If you guys are new here, we're doing NCLEX questions. Those last two answers I obviously didn't know how to pronounce because apparently I need hooked on phonics or something, you know. But anyways, hey, make sure you guys like, share, follow, and make sure you guys, hey, let me know where you guys are from and where you're at in your nursing journey if you are new here. Camille, what's up? Camille, I was waiting for you the whole time. I see you. Here we go. Here's our answer, y'all. Here's our answer in 3, 2, and the answer is D. Because some of the glucose in the bloodstream attaches to some of the hemoglobin and stays attached during the 120-day lifespan of red blood cells. Is it the glycosylated hemoglobin levels provide information about blood glucose levels during the previous 3 months? That is reduction of risk potential, which is 9 to 15% on the NCLEX exam. Okay, smaller than the bigger 3, but hey, still very, very much powerful and effective when it comes to the knowledge that you need to know for NCLEX. Okay, here we go. Question number 15. Nurse Trinity administers NPH insulin to a diabetic client at 7 a.m. All right. At what time would the nurse expect the client to be most at risk for hypoglycemia? Is it 10 a.m., noon, 4 p.m., or 10 p.m.? Remember, what does NPH mean? Like, what type of, is it fast acting? Is it rapid acting? Is it intermediate? Is it long acting? So what are we thinking? Okay. Got B's. We got B's. Okay. Okay. We got A's. A's. Short acting. Okay. Is it intermediate? Okay. Okay. Got B's. We got B's. Hey, this is very important. Hey, this is one of those sections that's very important for you guys to know on NCLEX. I'm telling you right now, because they'll ask you these questions in different forms, but you need to know what are the time limits for each insulin, like your rapids, like how fast do they go? What are their onset, their peaks, and their durations, right? For fast acting, intermediate, and long acting, okay? Here's our answer, y'all. Here is our answer in 3, 2, and the answer is 4 p.m., right? NPH is an intermediate acting insulin that peaks 8 to 12 hours after administration, okay? Because the nurse administers NPH at 7 a.m., the client is at greatest risk for hypoglycemia from 3 p.m. to 7 p.m., okay? Pharmacological and parenteral therapies, all right? Pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam, okay? Second largest section on the NCLEX exam, all right? A short acting would be like regular when you give it IV, but also think of Lispro, right? Lispro is a fast acting, 15 to 30 minutes, right? So usually when I give somebody Lispro, they need to have their food needs to be like with them. So they take it with meals, you know what I mean? So, and that's where this is where that additional research goes on your parts. Hey, as a matter of fact, I do one, where I talk about diabetics and I go over a chart, and I'll show you guys that. It's inside the course, and I'll show you guys that as well. Question 15, the adrenal cortex is responsible for producing which substance? Is it glucocorticoids and androgens? Is it catecholamines and epinephrine? Is it mineralocorticoids and catecholamines, or is it norepinephrine and epinephrine? What are we thinking? Shout out to all 48 of y'all in here listening to me run my mouth. Hey, we need 20,000 likes, y'all. 20,000 likes. Lantis, like Glargine, is 24 hours. Yeah. Yeah, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. Also, hey, if you were in nursing school right now, I don't care what semester you're in, you should be sharing this with your cohort. Right? I'm pretty sure y'all are all in group chats and y'all are all buddy. In reality, you're not. But share it to them anyway. Share it to them anyway. All right. Don't be greedy. I'm going to give y'all 10 seconds. All right, we got A. Denicia says A. Butter Baby says A. Is it Quant83 says A. Bellamon says A. User 90 says A. Okay, cool. So look like we got a general consensus. So let's see what the answer is in 3, 2. And the answer is A. The adrenal gland has 2 divisions, the cortex and medulla. The cortex produces 3 types of hormones: glucocorticoids, mineralocorticoids, and androgens, right? That is physiological adaptation, 3rd largest section on the NCLEX exam. Shout out to everybody that got that right. Super proud of y'all. Y'all keep the studying up. I love it. All right. Physiological adaptation, 3rd largest section on the NCLEX, 11 to 17%. All right. Hey, real quick, we are doing NCLEX questions. This is my commercial break, letting y'all know what we're doing, because I get a lot of people asking. Make sure you guys participate. I'm kind of funny sometimes, but hey, we're going through it today. You know what I'm saying? Make sure you guys share. Make sure you guys follow. Make sure you guys give me all those likes. All right. That is important. That is the trifecta that TikTok wants. All right. So don't be selfish your whole life. If you come in here and troll, I'm going to ban you. So don't be rude. Nurseslabs.com is where I got these questions from. 7-day NCLEX course. That link is in my bio. You get it for a lifetime, and all the updates, access to the Facebook page, all that good jazz. Right. Also, if you guys, and there's a free download over there as well. All right. And, Monis is in there too, guys. So, hey, she's super helpful for you guys. If you guys have any questions about nursing and all that good jazz, tutoring, coaching, ebook, all that good stuff is in my bio. Make sure you guys check those out. Okay. Here we go. Question 16. On the third day after a partial thyroidectomy, is it, Proserpina? Whose name is that? It doesn't matter. Exhibits muscle twitching and hyperirritability of the nervous system. All right. When questioned, the client reports numbness and tingling of the mouth and fingertips. Suspecting of a life-threatening electrolyte imbalance, the nurse notifies the surgeon immediately. Which electrolyte disturbance most commonly follows thyroid surgery? Is it hypocalcemia, hyponatremia, hyperkalemia, or hypermagnesemia? What are we thinking? All right, everybody screaming A. Okay, we got 1 C. We got A's. Hey, and just FYI, these questions could be asked in different ways, but you need to be able to know, like, hey, if I do a total thyroidectomy, for example, what type of disease process could that lead a patient to? You know what I mean? Still same type. Fun fact, I had a patient with this exact same symptom a week ago. Wow, look at that. Shout out to all 42 of y'all in here. We're doing NCLEX questions. Got them off nurseslabs.com. Make sure you guys keep smashing that like button. Trying to get to 20,000 likes, all right? Here we go. Here's our answer. Here is our answer in 3, 2, and the answer is A. Hypocalcemia may follow thyroid surgery if the parathyroid glands were removed accidentally. Signs and symptoms of hypocalcemia may be delayed for up to 7 days after surgery. Thyroid surgery doesn't directly cause serum sodium, potassium, or magnesium abnormalities. That is physiological adaptation, y'all. 3rd largest section on the NCLEX. Okay, 11 to 17%. Med-surg is where it's at. Yeah, med-surg. Hey, med-surg, you'll get a good plate of everything. Okay. Here we go. Question number 17. Which laboratory test value is evaluated in clients who smoke and can't be used as a general indicator of cancer? All right. Is it A, acid phosphatate levels, serum calcitonin levels? Is it alkaline phosphatate levels, or carcinoembryonic antigen level? What are we thinking? Shout out to all 43 of y'all. Hey, if you guys are new here, also, I want to know who you are, where you're from, where you're at in your nursing journey. If you're not a nurse, what you doing hanging out with us? We do these, hey, essentially now we're doing them every day, Monday, Wednesday, Friday. And that's probably why I got a low turnout today, but I still got a bunch of y'all in here. So I'm giving y'all all this knowledge, You know, just because it's 40 y'all don't mean y'all don't deserve it. Even if there's 4 y'all in here, y'all still getting this knowledge. Make sure y'all smash that like button. All right, y'all, let's see what's going on. Hey, oh, another fun fact, guys. I failed my NCLEX 3 times. 3. All right. And I'm going to just let y'all know, no job cares. No job gives a fuck if you guys fail. All right. Don't feel sorry. Don't feel bad for yourself for not being able to conquer the NCLEX the first time. It's a journey. The destination is the same, that license and getting out there to work, but the journeys are different. Trust and believe me. And you are no better. You are not a bad person or a failure if you were not successful at that exam at the first time. That's okay. The end game is that you fucking pass it. And the answer is D. Was it a carcinio embryonic antigen level? All right. A client who smokes, the level of carcinio embryonic antigen is elevated. Therefore, it can't be used as a general indicator of cancer. That's reduction of risk potential. All right. 9 to 15% on the NCLEX. OK, shout out to everybody that got that answer. Y'all keep up the participation, and we're going to the next one. And the question number 15. Francis with anemia has been admitted to the medical surgical unit. Look, hey, this is right up somebody's alley. Which assessment findings are characteristics of iron deficiency anemia? Is it night sweats, weight loss, and diarrhea, dyspnea, tachycardia, and pallor, nausea, vomiting, and anorexia, or itching, rash, and jaundice? What up? So what are y'all thinking? What do y'all think the answer is? Got B. Okay. Okay, what else are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions, both for RNs and LPNs, registered nurses, licensed practical, and licensed vocational nurses. All right, you guys can find these at nurseslabs.com, nurseslabs.com. The free sets of questions. I'm gonna give y'all 10 more seconds. All right. What are we thinking? Everybody's saying B. Okay. All right, well, everybody's screaming B at me. So let's see what the answer is, y'all. Let us see what the answer is in 3, 2, and the answer is B, dyspnea, tachycardia, and pallor. Signs of iron deficiency anemia include dyspnea, tachycardia, and pallor, as well as fatigue, listlessness, irritability, and headache, which is part of physiological adaptation, which is the 3rd largest section on the NCLEX exam. All right, they have the NCLEX test plan, and that is the 3rd largest section. I call it part of the big 3. All right. Here we go. Question number 19. Sorry if you guys hear my co-host in the back. My son, he doesn't know how to act because he's a toddler. So, you know, he runs everything but pays no bills. Here we go. Question 19. In teaching a female client who is HIV positive about pregnancy, the nurse would know more teaching is necessary when the client says what? So what did the client say that was incorrect that requires us to give her more teaching? Is it A, the baby can get the virus from my placenta? I'm planning on starting on birth control pills. Not everyone who has the virus gives birth to a baby who has the virus. I'll need to have a C-section if I become pregnant and have a baby. So what are we thinking? What are we thinking, y'all? What is the answer? What is the answer? All right, we got C. Okay, so we got C. Okay, Denisha also says C. Cool. Another Denisha. Oh, Denisha and Denicia. See, look, it's too close. Bree says D. Bree with the X. Okay. Aaliyah. Is it Aaliyah? Says C. Okay. The Canicia. Okay. Sure. Hopefully I'm going to mess it up. Not on purpose, though. You had it right? Oh, Denisha. Okay. We'll get it right. I'll get right. I promise. Here we go, y'all. Here's our answer in 3, 2. And the answer is D. I'll need to have a C-section if I become pregnant and have a baby. A cesarean section delivery isn't necessary when the mother is HIV positive, okay? That is health promotions and maintenance. Health promotions and maintenance. Hey, you may not agree. This is where reading your rationales is super important, and also doing more research when you're doing your content. So that way you can get an understanding. Hey, so a lot of times these things, some of these questions may be wrong and you may not agree with them. Look, I've used UWorld and Archer, and I have found so many of them that they're labeled right when they are most definitely incorrect. All right. So it's okay to do a little bit more research for yourself. All right. But don't get mad at yourself. Hey, they get omitted. You know what I'm saying? But you shouldn't be getting questions wrong. Here we go. Question 20. When preparing Judy with AIDS to discharge to the home, the nurse should be sure to include which instruction? Put on disposable gloves before bathing. Sterilize all plates and utensils in boiling water. Avoid sharing such articles such as toothbrushes and razors, or avoid eating foods from serving dishes shared by other family members. What are we thinking? What are we thinking? Everybody's saying C. Shout out to all 46 of y'all. We are doing NCLEX questions, nurses questions off of nurseslabs.com. Jasmine, thank you for the follow. Appreciate you. Make sure you guys go over there to nurseslabs.com and check that out. Hey, so we're trying to get 20,000 likes, y'all. 20,000 likes. Yari, why do I feel like you just got in here? Did you just get in here? Yeah, you did. I know that name looked familiar. All right, y'all. Here we go. On the road to 20,000 likes. That's what we're trying to get. All right. Yeah, I know. I knew you jumped in here. Here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is C. Avoid sharing such articles as toothbrushes and razors. HIV, which causes AIDS, is most concentrated in the blood. For this reason, the client shouldn't share personal articles that contain blood contaminated, such as a toothbrush and razor, with other family members. That is part of health promotions and maintenance. All right, health promotions and maintenance, which is also 9 to 15% on the NCLEX. A little bit lower than the bigger 3, but still very important. All right. Hey, real quick, we are doing NCLEX questions for nurses, all right, RNs and LPNs, all right. Make sure you guys participate. I'm kind of funny. I'm kind of all right today, you know what I'm saying? I ain't really getting the feedback that I like, but I'm still be out here doing my thing, you know what I'm saying? So make sure you guys share, make sure you guys follow, make sure you guys give me all those likes. Stop being selfish, you know what I'm saying? Yari, hey, you know what, Yari? Since you got in here late, you know what that means? Hey, get carpal tunnel for me right now. Hey, 20,000 likes, make it happen right now, all right, make it happen. Hey, don't troll my chat or I'm going to ban you. Promise I'm going to do it. I'm petty and I enjoy doing it. All right, so don't be rude. Nurseslabs.com is where I got this question from. Hey, if you're looking for an NCLEX course for a lifetime, you get it for $97. Check out that link in my bio. Also, I got a free download over there. I do tutoring, coaching, as well as I have an ebook over there. Check that out for yourself as well. All right, and I'm going to do an Ask Me Anything to follow. So if you guys have any questions, please ask them. What does it says? What does it say? Hi, thank you for your your words of encouragement. Dollar Queen, you are welcome. Rach, what did you say? It says, appreciate you reading the question and the answers. I'm still learning while driving home. I was shouting my answers. Hey, Rach, that's the kind of participation that I like to hear. I love that you do that. I will read them that's just kind of my thing. It makes it a little bit easier for folks. Here we go. Question 21. Nurse Marie is caring for a 32-year-old client admitted with pernicious anemia. Lord have mercy. Which set of findings should the nurse expect when assessing the client? Pallor, bradycardia, and reduced pulse pressure. Pallor, tachycardia, and a sore tongue. Sore tongue, dyspnea, and weight gain, or angina, double vision, and anorexia. What are we thinking? Hey, don't judge me on the way that I talk, okay? Don't judge me on the way that I pronounce things, all right? Rach is saying B, okay. Rach, is somebody answering for you while you're driving? Because I hope you ain't answer me while you're driving, because, man, that is not safe. I do not condone texting and TikTok living and driving, okay? Hey, if you guys are new here, welcome. We are doing NCLEX questions. Know you're at home? Okay, I got you. We're doing NCLEX questions. Got them off nurseslabs.com, okay? Nurseslabs.com, free sets of questions. Make sure you guys smash that like button. You guys share. You guys follow. Nurseslabs.com is where I got these questions. They're free questions. Also, if you're a nursing student, they do care plans over there. You know, learn about those nursing diagnoses and you get, you're related to as evidenced by, you know what I'm saying? So here we go, y'all. Here we go. B. I got you. Here we go. Here's our answer in 3, 2, and the answer is B. Pallor, tachycardia, and a sore tongue are all characteristic findings of pernicious anemia. Other clinical manifestations include anorexia, weight loss, a smooth, beefy red tongue, and also as well as a wide pulse pressure, palpitations, angina, weakness, fatigue, paresthesia of the hands and feet. Physiological adaptation, third largest section on the NCLEX, 11 to 17%. All right, the third largest section. Be aware of that, okay? Be aware of that. All right, here we go. Question number 22. After receiving a dose of penicillin, a client develops dyspnea and hypotension. Oh, what is that, y'all? Nurse, was it Celestina? Suspects that the client is experiencing anaphylactic shock. What should the nurse do first? What should you do first? Immediately, right? After you suspect it. Page an anesthesiologist immediately and prepare to intubate the client. Administer epinephrine as prescribed and prepare to intubate the client if necessary. Administer the antidote for penicillin as prescribed and continue to monitor the client's vital signs, or insert an indwelling catheter and begin to infuse IV fluids as ordered. What are we thinking? What we thinking? Hey, shout out to all 56 of y'all. We are doing NCLEX questions. I want to know who you are, where you're from, and where you are at on your nursing journey if you are new here. That's what I want to know. It helps us, create that good conversation down in the chat. All right. Hey, once again, I failed my NCLEX 3 times, y'all. You want to know why I do this? It's because I don't ever want nobody to feel how I felt. Like you didn't belong here, like you weren't worthy of being a nurse, all that good jazz. That's why I do it. And I create these words of encouragement, and I want to create a community to where, we can push each other in a constructive way. You know what I'm saying? I don't do that nurses eat their young shit, because to me, it's just like you can't grow as a profession like that, which is why the profession is in the state that it's in, where people don't want to stay bedside. You know what I mean? So I'm all about pushing everybody in a positive direction. I don't coddle you, but I'll let you know what's up. All right, here we go. Here's our answer in 3, 2, and the answer is B. To reverse anaphylactic shock, the nurse first should administer epinephrine and a potent bronchodilator as prescribed. Management of care, right? The largest section on the NCLEX. The largest section on the NCLEX at 18 to 23%. All right. It is the largest. All right. Hey, priority questions, delegation, assignment, management. That's all these questions. All right. That's what management of care consists of. All right. Here we go. Question 23. Mr. Marquez with rheumatoid arthritis is about to begin aspirin therapy to reduce inflammation. When teaching the client about aspirin, the nurse discusses adverse reactions to prolonged aspirin therapy. These include what? Is it weight gain, fine motor tremors, respiratory acidosis, or bilateral hearing loss? What are we thinking? Mame says D. Bree with the X says D. That's what you said, right? You said D? Yeah, you said D. Okay, cool. I'm from Nigeria studying nursing in Poland, and I'm graduating in 24. Okay, Queen Dollar, that's what I'm talking about. You're Nigerian and you live in Poland? Hey, I'm not even gonna lie. I've always wanted to go to Poland. I've only been to Germany. And I was there for about 2 weeks, and I enjoyed it a lot. So, hey, you don't take your NCLEX until February 2024. Hey, go over there and check out that NCLEX course. You get it for a lifetime. And you get all the updates. I'm working. I have about 6 videos that I'm editing right now, and those are going to be up here within the next week or so. So, hey, letting y'all know. Also working on my cardiology section for content. So you already know what the deal is. We are moving, baby. We moving. Aspirin equals tinnitus. Okay, Bree. All right, here's our answer. In 3, 2, and the answer is D. Bilateral hearing loss. Prolonged use of aspirin and salicylates sometimes cause bilateral hearing of 40 to 50 decibels. Usually this adverse effect resolves within 2 weeks after the therapy is discontinued. Okay, that is reduction of risk potential, which is 9 to 15% on the NCLEX exam. Okay, smaller than the big 3, but still all 8 sections within the client needs of the NCLEX plan are all very important. It doesn't matter their percentage. However, some are larger than others. Okay, so good job on hey, shout out to everybody getting a answer and participating. I love it. Question 24. A 23-year-old client is diagnosed with the HIV or H5. If you guys were here yesterday, you guys heard about my H5 story. After recovering from, or H4, not H5, sorry. After recovering from the initial shock of the diagnosis, the client expresses the desire to learn as much as possible about HIV and AIDS. When teaching the client about the immune system, the nurse states that the adaptive immunity is provided by which of the white blood cells. Is it the neutrophils, basophils, monocytes, or lymphocytes? What are we thinking? Shout out to all 48 of y'all in here listening to me run my mouth. I want to definitely make sure I get the questions said and the answer said for those who need it. You know what I'm saying? Because I record content all day, every day. So sometimes your boy get winded and he get tired. So what are we thinking? We got A, we got D. Okay. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Hey, we're on the road to 20,000 likes. You know what I'm saying? I need 20,000 likes before we get off here today. All right. Also, if you're new here, I want to know who you are, where you're from, and what part of the world are you from? Somebody just told me Poland. I've had some people in here from Nepal, New Zealand, Australia, South Africa, South America, the rest of Africa. So Had some people in here from the UK, so hey, I'm all about this. Listening while I do the dishes in my third semester RN school. Thank you for this, Jill. You are welcome. I hope you're following, and I hope you're you liking, you share, because it's super helpful. New here from MN. What's MN? Is that Minnesota? No, it ain't Minnesota. What the hell? Michigan. Elise, Michigan. From the UK? Okay, girl, that's what I'm talking about. All right, here we go. And the answer is D, lymphocytes. The lymphocytes involve adaptive immunity, recognition of a foreign antigen, and formation of memory cells against the antigen. Adaptive immunity is mediated by B and T lymphocytes and can be acquired actively or passively. That Minnesota, yeah. See, I got it right the first time. Oops, but you already know Minnesota. You have an accent, don't you, Elise? Mm-hmm. Health promotions and maintenance. All right. That is a smaller section on the NCLEX. All right. Smaller section. What is it? 6 to 12, 9 to 12, something like that. All right. Hey, as long as you understand that the big three are the big three, then you know what the deal is. All right. Oh man, I meant to look this up because I always mispronounce it. But in an individual with the Sjögren's syndrome, nursing care should focus on what? Moisture replacement, electrolyte balance, nutritional supplementation, or arrhythmia management. I'm literally about to look this up. Because I stay messing it up. I'm gonna get Google to read it to me. I'm pretty sure somebody's gonna be like, Kevin, you said it wrong. And I'm like, okay, fine. Sjögren. Oh. Sjögren's. Oh, Sjögren's. That sounds Nordic. Like I've been playing a lot of God of War, and it sounds real Nordic to me. All right, everybody's saying C. All right. Let's see. Got A's.
Sjögren's syndrome.
Oh, see, look, Jugal said it for me. All right, y'all, here we go. Here is our answer. In 3, 2, and the answer is A. Sjögren's syndrome is an autoimmune disorder leading to progressive loss of lubrication of the skin, GI tract, ears, nose, and vagina, right? Moisture replacement is the mainstay of therapy. That is physiological adaptation, which is what? The third largest section, Sjögren's. Look, Nia, you coming over here? Now you're, I'm not going to say, I can't say this word that I want to say because I may get banned or I may get flagged for saying it, but you can't be a grammar person coming up in here, okay? All right? But I appreciate you. I'm going to remember that. I always mess it up in school anyway, so I didn't care. Physiological adaptation, third largest section on the NCLEX, 17%. All right. Hey, real quick, for all those that are out there listening, doing dishes while they're listening to this study session, we're doing NCLEX questions, RNs, LPNs. Make sure you guys participate. All right. Give me all those likes. Give me all those follows. Make sure you guys share. Hey, we're on the road to 20,000 likes, y'all. I need 20,000 likes before we finish. Don't be selfish your whole life. Get carpal tunnel for me. Sjögren's. Okay. Sjögren's. All right. Don't troll my chat. You troll my chat, I'm going to ban you. Nurseslabs.com is where I got these questions from. Make sure you guys go over there and check those out for yourself. Also, 7-day NCLEX course, coaching, tutoring, ebook, all that good jazz is in the link in my bio. You guys can go over there and check that out. Also, I'm going to do an Ask Me Anything after this. If you guys have any questions, let me know what's up. Question number 26. During chemotherapy, the lymphocytic lymphocytic leukemia, Matthew develops abdominal pain, fever, and horse barn smelling diarrhea. That's probably key. It would be most important for the nurse to advise the physician to order what? Is it the ELISA test, an electrolyte panel and hemogram, a stool for Clostridium difficile test, or is it a flat plate x-ray of the abdomen, right? Everybody screaming C at me. Is it C for C. diff? And for all y'all that don't know, C. diff is probably one of the best smells that you'll ever smell in your entire life. Oh God, I couldn't. I'm sorry. Let me not set y'all up. C. diff is terrible, y'all. It's terrible. And once you smell it, you'll never, ever forget it. Okay. Just make sure you get like a peppermint or some shit and have it in your mouth, because you would rather smell your own peppery breath than smelling some C. diff. I'm just thinking, oh, here we go. Here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is stool for Clostridium difficile test. Immunosuppressed clients, for example, clients receiving chemotherapy are at risk for infection of C. diff, which causes horse barn smelling diarrhea. Successful treatment begins with an accurate diagnosis, which includes a stool test. Okay. That is what it is. That is what it does. Trust and believe me. Oh, hey. So here's the thing. If somebody tests positive for C. diff, what type of precaution are they on? What type of precaution are they on? Hey, let me know. Let me know down in the chat right now. You know what I'm saying? While we go on to the next one, question number 27. A male client seeks that contact. There you go. Contact. Appreciate the rose, Glenn. I appreciate you, sir. Here we go. Question number 27. A male client seeks medical evaluation for fatigue, night sweats, and 20 pounds lost in 6 weeks. To confirm the client has been infected with HIV, the nurse expects the physician to order what? All right. Which one? Is it the E-Rosette immunofluorescence? Is it the qualification of T lymphocytes, enzyme-linked immunosorbent assay or ELISA, or is it the Western blot test with ELISA? All right. I don't know who ELISA is, but this chick be everywhere. All right. Shout out to all 45 of y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys smash that like button, y'all. Smash that like button. You guys share. You guys follow. Get it out to everybody. All right. Hey. If you're in nursing school right now, you need to share it to your cohort. You know what I'm saying? Share it to your cohort. All right. Don't be greedy. All right. You can't be selfish your whole life, Rach. You got to share me. All right. I don't know why I just picked you out. I see your name up here. That's why. All right, y'all. Here we go, y'all. Here is our answer. In 3, 2, and the answer is D, Western blot test with ELISA. See, she everywhere. HIV infection is detected by analyzing blood for antibodies to HIV, which form approximately 2 to 12 weeks after exposure to HIV and denote infection. The Western blot test, the electrophoresis of antibody proteins, is more than 98% accurate in detecting HIV antibodies when used in conjunction with the ELISA test. It isn't specific when used alone. That is reduction of risk potential, right? 9 to 15% on the NCLEX exam. Woo woo. Shout out to y'all. Shout out to everybody that got that answer right. And if you didn't get it right, this is how you practice. And you get content, you do Q&A, and then you do rationales. That is how you solidify. And retain the information, okay? Practice. Don't try to go into nobody's test or no NCLEX without practicing, okay? Then don't be surprised when you fail, because you'll be like, why did I fail? Oh, maybe because you didn't study. Stupid. No, I'm just playing. Here we go. Question 28. A complete blood count is commonly performed before Joe goes into surgery. What does this test seek to identify? All right. Is it A, potential hepatic dysfunction indicated by decreased BUN and creatinine levels? Is it low levels of urine constituents normally excreted in the urine, abnormally low hematocrit and hemoglobin levels, or is it electrolyte imbalances that could affect the blood's ability to coagulate properly? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions for registered nurses and licensed practical/vocational nurses. All right. Also, if you're new, hey, it doesn't matter what you are. If you're an RT, if you're a patient care tech, if you're a respiratory tech, occupational, whatever. If you're a PA, med student, hey, all the love up in here. You know what I'm saying? Get your learn on. All right. Also, if you're new here, I want to know who you are, where you're from, and what part of the world are you from. We had some Poland up in here. Had some people from Nepal. Hey, that's where Mount Everest is at, y'all. The Philippines, you know what I'm saying? MedX student here. Okay, nice to see you, sir or ma'am. I can't tell because your picture's so small. Illinois. You're from Illinois? Oh, okay. I'm saying that wrong on purpose, by the way. I'm just letting you know. And the answer is C, Florida. Hey, I was in Jacksonville for about a good 4 years, so I know a little bit about Duval. You know what I'm saying? Low preoperative hematocrit and hemoglobin levels indicate that the client may require a blood transfusion during or before surgery. If their hematocrit and hemoglobin levels decrease during surgery because of blood loss, the potential need for a transfusion increases, which is reduction of risk potential. You're from LA. Ew. I mean, hey, shout out to you, I guess. Yeah, anticoagulant. You know what I'm saying? Shout out to LA. You know what I'm saying? Appreciate y'all. My thumb is numb now from sending love, LOL. It's at least 18,000 likes now. Hey, we're right at 18,000. I appreciate y'all. Hey, since, Rach, other people out here being greedy, I need other people out here to get numb thumbs. Hey, get numb thumbs for me. Carpal tunnel, baby, make it happen. Here we go. Question 29. While monitoring a client for the development of disseminated intravascular coagulation or DIC, the nurse should take note on What or of what assessment parameters? Is it platelet count, prothrombin time, and partial thromboplastin time? Is it platelet count, the blood glucose levels and white blood cell count? Is it thrombin time, calcium levels, and potassium levels? Or is it fibrinogen levels, white blood cell count, and platelet count? What are we thinking? What are we thinking, y'all? What are we thinking? Hey, shout out to hey, I had some people from Jamaica up in here. I think Belize was another one. I had one from Brazil, or a few people from Brazil. So, hey, nursing is nursing is nursing. You know what I'm saying? Some of the nuances are different depending on what country that you're in. But, hey, all relatively, the end game is the same. The end game is the same. You know what I mean? So, what are we thinking? We got people screaming A. Okay. Yari says A. User 38 says A. Okay. All right. Nadia says A. Okay, Nadia, I see you out there. Gary, I see you. All right. Okay. PT and PTT minus A. What? You mean is A? No, I got you. We're good. I got you. Yari, thank you for the... appreciate you, girl. I appreciate you with the finger heart. You know what I'm saying? Just right there, snapping. That's how we do that. Here's our answer, y'all, in 3, 2, and the answer is A, platelet count, prothrombin time, and partial thromboplastin time. The diagnosis of DIC is based on the results of laboratory studies of the prothrombin time, platelet count, thrombin time, partial thromboplastin time, and fibrinogen levels, as well as client's history and other assessment factors, right? So what, the PT, PTT, right? And the platelet and the PCT, I think that's for platelet count, right? That's reduction of risk potential, 9 to 15% on the NCLEX. All right, shout out to everybody who got it right. Hey, but if you got it wrong, that's okay. This is what this is here for. You got to study, okay? Give love while waiting for answers. Hey, you already know the deal. All right, here we go. Question number 30. When taking a dietary history for a newly admitted female client, Nurse Lynn should remember which of the following foods is a common allergen. Is it bread, carrots, orange, or strawberries? What are we thinking? What are we thinking? Rach says it's A. Okay, what else? What else? Which one of these have common allergens or has a common allergen? User 38 says D. Okay. VV says A. Strawberries for user 38. I got you. Jamie says D. Okay, Jamie. Okay. What else? This chick is bad to the bone. Bad to the bone says A. Okay. Cece says D. Honestly, I have no idea. Jamie, that's okay. Where do you see peanuts at, Jamie? Really? Lord have mercy. Lord have mercy, lady. All right. But yeah, hey, I would rather, if you don't know, that's okay. I would rather you guess. You have a 25% chance of getting it right. You know what I'm saying? Versus if you just don't guess it at all or you don't answer at all. But also think about it. Apply what you know versus trying to apply what you don't know. When you apply what you know, the process of elimination is a lot easier. Okay. All right, y'all. But here we go. Here we go. Here is our answer. Here is our answer in 3, 2. And the answer is D. It's strawberries. Gluten. Gluten. Wow. It's strawberries. Common food allergens include berries. Somebody did say peanuts, right? Oh, shit. I got that right. Look, Jamie, look at that. See, look. Don't count yourself out. Don't count yourself out. You know what I mean? Hey, look, you guessed and you got it right. You had a 25% chance of getting it right and you got it right. But you did say peanuts, though. But the answer wasn't on there, so I ain't letting that slide. You know what I mean? Berries, peanuts, Brazil nuts, cashews, shellfish, and eggs. Think about the allergies that people have normally, right? You know, like that are, remember, the key word in there was common. People do have allergens to peanuts. You know, like think about peanut oil. You know what I'm saying? Like you go to places, hey, I can't have anything with peanut oil or else I'm going to be factory reset at this restaurant table. You know what I'm saying? So think about stuff like that. That's part of basic care and comfort, which is 6 to 12% on the NCLEX. One of the lower sections, but of course, still very important. Why? Because some of y'all got this wrong. You know what I'm saying? That's why it's important. It's still important regardless. All right, ladies and gentlemen, but that is it for our questions today. We're right at an hour, which is exactly where I wanted to be, right? So, hey, this is a wrap. I appreciate everybody participating, but hey, you guys can hang out. It's been real, but you guys can hang out. You guys can ask me questions after this. You know what I'm saying? Hey, I appreciate the love. I didn't have to ban nobody. Y'all already know where to find these questions at nurseslabs.com. Of course, 7-day NCLEX course. You guys can check that out as well as coaching, tutoring, the ebook. Those links are in my bio. But now we're going to do an Ask Me Anything. All right, we're doing Ask Me Anything. I'll turn this thing around so y'all can see my face. What is the deal? Hey, today is Tuesday, y'all. Today is Tuesday. If you guys have never been here, I always do. It says, thank you. I'll be back. You do this Monday, Wednesday, and Friday. Donicia. Yes, I do. But I'm probably going to start doing them every day. But we'll see. We'll see how the turnout is. If it doesn't look all that great, then I'm probably just going to go back to the 3 days a week. But you will see me here tomorrow for sure. All right. So unless something pressing comes up, then you will most definitely see me here tomorrow. So I appreciate y'all smashing that like button, getting me to 20,000 likes. Now we had 20,000 likes. That's what I'm talking about. So I appreciate y'all. But yeah. What questions do you guys have? I know a lot of people, they always ask me about the course. They always ask me about, what to expect when they get into their floor, all that good jazz, right? It says, I'll set some alerts so that when you go live on, that's what I'm talking about. I appreciate that. I appreciate it because I want you to be here. Also, if you guys go and you guys check out if you guys go and check out my YouTube, all of the TikTok lives that I do, if you miss them, they're going to go up there as well. They'll go up there as well. So, hey, of course, if you guys are new here, a little bit about me. I've been in the Navy for 16 years. I've been a nurse for 3.5 years. I've worked in 3 different ICUs, OR, as well as PACU. I'm a Navy instructor. I've been an instructor for about 8 years. I'm actually a master instructor. I've taught in multiple different programs to include surgical technology, a tactical combat course, as well as pre-hospital trauma, advanced burn, stuff like that. So most definitely have a good plethora of knowledge within the medical realm. Been on 2 deployments, one to Guantanamo Bay, Cuba, the second one to Afghanistan, part of a forward surgical team. So I got to do life, limb, eyesight type of surgical procedures, all kinds of fun stuff that you will never be able to do here in the States, because when you're at war, and there's a little bit things that you can do that are more expanded on that. But anyways, hey, I failed my exam 3 times, y'all. 3. So one thing I'm going to tell y'all is that don't give up, y'all. This exam is a mindset thing. The whole thing about NCLEX and the whole thing about being a nurse, I promise you, it is a mindset thing. You're going to have people that try to eat they're going to try to eat you. They want to eat their young. That's just what they do. They have this God complex, everything from doctors to those senior nurses. You know what I mean? So the biggest thing is that you got to realize how you got to move through here. You know what I mean? You got to move through nursing, in the smoothest way possible. A lot of people won't agree with me. But I'm going to tell you something right now. When you become a nurse, the very first thing that you need to be thinking about is how to exit bedside. It's how to exit bedside. Unless you want to stay bedside, then you can do that. But the one thing I always say is once you become a nurse and you're in bedside, how are you going to exit bedside? What can you do? That's not saying that anybody is above bedside, but bedside essentially is that's arduous work. It's hard on your knees, hard on your back, hard on everything. You know what I'm saying? And then you got, physical things that you got to do and be aware of when it comes to patients X, Y, and Z. So one thing I always say is how can you exit bedside? You know what I'm saying? Get your knowledge in bedside or based off of what you want to do. So if you want to go MP, got to work bedside. You want to go ICU? If you want to go CRNA, got to work bedside. But hey, what is your exit strategy? So you can get more experience when you leave bedside or when you exit bedside, or what do you want to do, right? And it says who was your favorite student? Oh, I have many favorite students, but I am not falling for that one, sir. Honestly, it's probably you because you come to my lives all the time. So starting nursing school in January, and I love your lives. Is it oh my God. Micah. It is a trap. That's what I'm saying. It is a trap. I don't know what he's trying to do to me, right? But I appreciate you. You start nursing school. Hey, Micah, you already know the deal. Time management is a very important thing for you. Or it's either Micah or Mika. You know, hey, you know who I'm talking to, right? So the one thing that I will tell you is that time management, have it down, or be ready for it, because your first semester of nursing school is going to humble you hardcore. And be ready. If you have kids, if you have a family or anything, you definitely got to let them know, hey, I'm not going to be available as much I'm not going to be available as much, because nursing school will literally tell you, hey, sacrifice your family. I'm going to tell you don't do that, right? But definitely be prepared for that. I had to literally put myself on an Excel spreadsheet for times, and I had to stay to it, right? It took me first semester to figure that out. So that's what I would definitely tell you right now. It says I'm on it. I always stay weeks ahead of my work. Okay. You say weeks ahead of your work now. But just you wait. I'm not trying to, discourage you, but everybody has a plan. until they don't. Or how's Mike Tyson say? Everybody has a plan until they get punched in the mouth. First semester usually punches people in the mouth, but I know that you'll be prepared for it. Hey, look, check this out. Check this out. You got a good community of folks that'll help guide you through it. You're gonna come here and be like, Kevin, oh my God. I'm gonna be like, told you. I told you. I've been an LPN for 18 years, and I'm trying to start my own business now. That's what I'm talking about. Relationship type. What type of business are you trying to start? I'm actually kind of curious now. Marilyn. Oh, Marilyn, have you been here the whole time and you've been hiding? That's the first time I seen you say anything. How dare you? How dare you? Nursing school humbled me for sure. I bet it did. What's your opinion on travel nursing? Travel nursing, put it this way. As a travel nurse, you will still make more money than if you were as a staff nurse, right? And you could do, you have the autonomy. You could pretty much essentially do, like kind of like what you want. Me, I want to travel, but I don't want to travel as a nurse anymore. Like when I first started working bedside, my first year, I was like, yeah, that's what I want to do and blah, blah, blah. And then I'm just like, nah, I don't want to do it anymore. If I'm going to travel, I'm going to do it the way that I want to do. And I'm not do it based off of nursing. If I was younger, I would do that. But it's just like, it's not really my cup of tea anymore. I'm ready to be humbled. I already told my dad and son, okay, I will not be there at all. Oh, well, that's fair. Well, be there for your son. Be there for your family. Okay. I'm not trying to tell you to neglect them, but as long as you have that adult conversation with the people that are in your family and that, that you take care of or, vice versa, definitely want to keep them in the loop. Look, I was in nursing school and I missed so many things. Hell, there was one time I think we went to Vegas and I had a test that I needed to do and I did not want to be in Vegas at all. But I went there because, I was being supportive of somebody else. And the whole time it's like I wanted to be stuck in the room because I was studying for my exam. That's all I cared about. I did not care about being in Vegas. You know what I'm saying? Turn it up. Did I go to the Kanye West concert? No, that wasn't it. It was probably before that. But y'all know. I'm saying, prioritize your time. It says, I see a lot of videos about nurses, about toxic work environment and travel nursing. It scares me, but okay, we will get there. So here's the thing. We will get there. Oh, you want to do an adult daycare relationship type? That's the type of, I work for, shift key. Oh, that's what you do as a travel nurse. You do adult care. Okay. Tracking. But we will get there. Yeah. So, it's true. It is very true. Like, I don't know a unit that doesn't have toxic people that are on it. But what the real issue that starts to happen is when you start having toxic leadership, because everything starts at the top. Everything starts at the top. So if you have a toxic director, if you have a toxic fucking manager, then, I'm trying to tell you, you'll have people that they, like the good old boys or the good old girls club, where people are cliquey and, they start, taking it. It happens a lot. So that's why I always say it's just like, be aware of your surroundings. And, like if you're in a place and you're just like, I don't like it, hey, it's time for a change. And here's another thing. You don't always have to work bedside. Being a nurse does not mean you have to work bedside. It does not mean that at all. All right. Your license, either an LPN or an RN, you are the CEO of that. There's so many jobs that are out here that are non-traditional that you can do as an RN or an LPN. It is not. They don't talk about it in school because their whole point is to get you. Everybody in school, their thought process is everybody needs to go to a hospital. Everybody needs to do bedside. No, this is not how it works. It's not how it works anymore. My whole family went on a trip to the Bahamas without me. I stayed because I had finals. You want to know something, Marilyn? That's okay, though, because guess what? That's what we call delayed gratification, right? Because guess what? Get this license. You ain't got to worry about it no more. And then you can go on as many fucking vacations as you want. You know what I'm saying? You can get as many. You can go. It doesn't matter. Bahamas ain't going nowhere. You think those islands are just going to fucking disappear? Does it look like Deep Impact? I don't think so. You know what I'm saying? So you guess what? Reward yourself to the Bahamas. Okay? And buy me a ticket too, because I'm trying to go. But we will get there. Hey, you're welcome. You're welcome. Amber said, we have lost so many people over the last year due to toxic management. Here's the thing, Amber. Well, you lose them all the time. You want to know the thing that's really shitty is that when you have the good managers that fight, they ended up either quitting or getting fired. And then they end up putting people that are there that are like yes men or yes women. And then next thing you know, that's when the toxicity is just back there, because in the end, it's all about the bottom line. But as a new nurse, you need hospital experience, right? It depends, Vivi. It depends on what you want to do. I know nurses that went into school that graduated with their RN that have never touched a patient. And they work in these other places. Most is because they were either working there as an assistant or doing whatever, right? I know nurses that have never went to a hospital. They went straight to a clinic. You know what I'm saying? I know nurses that got their degree and then went straight into public health because they already had a degree in public health. You know what I'm saying? I know other people like myself. I could have went into education realm, but I decided I wanted to go bedside because I wanted to go CRNA at that point. So it all just depends. But I'm telling you, schools will push you to do that. Mostly it's because schools have contracts with the hospitals, as in it's like a pipeline thing. You know, go through school, get into a residency program with this hospital because, you know, they already have memorandums of understanding and blah, 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 blah. So you don't always have to go get your experience at a hospital. You don't always have to do that. So that was a good question, though. But yeah, shout out to all 30 of y'all in here listening to me run my mouth. Hey, if you guys are finding value, make sure you guys smash this like button with that dude who has his hands in his pocket with his fanny pack. Bro, let me tell you something. I love that fanny pack. I used to try to be that dude. And then next thing you know, I put everything in my pockets. And next thing you know, I bend over, my whole damn life is on the floor. And I'm just like, fuck that. I'm getting a fanny pack. Moment I got it, I'm just like, shh, boy, I'm professional. I make my butt look big. You know what I'm saying? We walk around, the girls be like, ka-chow. I'm like, yo, you already know the deal. You know what I'm saying? But I'm just playing. But I legit though, I love that fanny pack. Not even gonna lie to you. Marilyn says, any tips on the interviewing process as a new grad? I have an interview coming up. All right. So questions that you need to ask. First of all, what are the patient ratios? Okay. Especially where you work. Like if you're like, or what area you're going to work. Like if you're going to ICU, 2 to 1, two patients to 1. You should never have 3. You should never have 4 ever. All right. You need to know about safe patient ratios. You need to know about pay. You need to know about your orientation time. How long is your orientation? Right. And then if you can get extensions on your orientation. The biggest thing is that they're just like, no, you're good. You're going to learn as you go. But here's the thing. They'll be trying to, I've seen it to where they're just like, hey, you know what? We're going to take you off orientation 3 weeks early because we need people on the floor. That's not a me problem. That's not a Maryland problem. That's a management problem. You're going to pull me off 3 weeks early when I ain't been exposed to damn near nothing. And just so we can, no. Hell to the no. Right? So that comes to my next thing is learning how to stick up for yourself. I would recommend getting, like a notebook. It looks like this, like just a regular notebook, whatever. And then writing down the questions that you have. Ask them about the training. Ask them about, if you want to know about certifications, like depending on where you go, CCRN, CEN, MedSurg, CERT, all that stuff. But most definitely it's pay. Ask them about, pay intervals. Also the patient ratios, the orientation time, preceptorships. So how, what is it like being with your preceptors? How many preceptors you're going to go through? I went through like 9 preceptors. It was fucking terrible. But then again, it was during the second wave of COVID and so many people had left. So we were everybody was thrown to the wolves, to include myself. And so, and I don't wear that like a badge of honor because that should not have been that way at all. Yes, 9. You heard what I said. 1 less than 10, 1 more than 8. So I think why I quit the ICU part 4. I said I had so many preceptors and I said 7. After I put that out, I had to rethink about it. I was like, wait a minute, I had 2 other ones. So I had fucking 9 preceptors. So my start off in the medical and neuro ICU. Well, it's the medical ICU and I floated to the neuro ICU, but my start off in those ICUs, terrible. When I worked in the burn center ICU, it was 1-to-1 and I had essentially the same preceptor, probably I think 1 or 2, like 2 or 3 different preceptors, right? But everybody knew each other and everybody bounced off each other in the burn ICU. But in the medical ICU, oh no. Yeah, that is ridiculous. I'm telling you, go to my bio, and then I have it in a playlist. But look, it says why I quit the ICU, and go look at all of them. I actually have a few more on my list that I want to add on there, right? About nurse educators, fucking trash. Oh my god. Some other parts of management, trash. The complete disregard of the lack of training or whatever. Just nope. Well, I did gain some really good friends there. So, but yeah, I know I kind of went off on a tangent, but Maryland, hopefully that answers your question. Ask about the ratios, ask about safety. Ask about what are the policies if you end up outside of a safe patient nurse ratio. In Texas, we call it safe harbor. And here's the reason: if I'm in the ICU and you give me more than 2 people, Now I can't guarantee the quality of the care to this third person or fourth person. So, and if something happens to that patient, AKA, factory reset or unalived, you're covered, because they're going to be like, well, what happened to this patient? Because they're going to do an investigation. They're going to be like, what happened to this patient? They'll be like, look, I had 4 patients that day. And 2 of them were over here. 1 was on the other side of the floor and the other one was on the back side. Like, how do you make that happen? I've actually seen and had some stuff like that happen to people. You know what I mean? So it's wild out here. It's wild. So hopefully that answers your question. But what other questions do you guys have? I'm gonna hang out for about another 10 minutes. But I want to know what questions do you guys have. Also, quick little plug. If anybody's looking for an NCLEX course, and those who are already nurses already know what the deal is, check out the 7-day NCLEX course. That link is in my bio. All right. It's going for $97 and you get it for a lifetime. You get all the updates to include all of the content and all the videos that I'm going to be putting up in there. You get access to the Facebook page. You get all that stuff, right? And as a matter of fact, I'm going to show you guys what it looks like real quick, because I know I had somebody ask me earlier, like way earlier in the thing. So here we go. So when you guys go to the link in the bio, this is what you'll see, right? You'll see this page right here, right? And then they'll say, yay, check this out, blah, 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 blah. And then there'll be this dude right here, talking about preparing for the NCLEX. And then, you go to log in or enroll, and it's right there. Hey, usually this is what the normal price is, right? But then it's going for this. It's going to be like this for a while, okay? You get an on-demand NCLEX course. You get the new generation NCLEX course, which is 4 hours worth of content, 100 questions that I go through, as well as you're going to have well over 100 pieces of content that are going to be in there, right? Getting updates, Facebook page. And yes, this is for RNs and LPNs. Once you're inside there, if I can find the right one. Nope, that ain't it. It's this one. So once you guys are in there, this is what it's going to look like, right? And I think, Marilyn, I think I showed you this one the other day, right? Or yesterday. So once you guys are in here, this is what you guys get, right? This is all the content that's in there right now. Let's check this out. New generation NCLEX, y'all. I go over questions and answers. You know what I'm saying? We go through questions and answers. And to answer your question, yes, there is new generation NCLEX questions in here, such as case studies, right? Let's go and find them. Marilyn, did you feel that the question that I answered your question right? Okay, yeah, you said thank you. So here we go, right? And y'all notice the dyslexia, right? It says, Kevin, I passed my HESI final today. That's what I'm talking about, Vaughn. Yes, ma'am. Shout out to you. Congratulations. That's your exit HESI, right? Let us know. Hey, so there's case studies right here, right? There's case studies right here, right? And then we do have the multiple choice questions, select, let, apply, all, the close, all those good things, right? And then of course, the ones that people love the most, right? Which are the bow tie questions. Like we go through those, break those questions down. Second semester, okay. Hey, second semester down, only probably 3 more to go, right? So, hey, got all this stuff in here. And of course we got all the content over here, pharmacology, right? Let me show you. Hey, pharmacology, y'all. Got 18 videos of pharmacology up in here. All right. So make sure you guys can go over there and check that out for yourself. Also, a lot of people are asking about tutoring, right? Anybody looking for tutoring, look, you get a Zoom call, right? With me, we talk about, we tutor, we coach, we go over ATI, we go over HESI. Also, you get mentorship, career guidance, essentially whatever your pain point is, we talk about it. You know what I'm saying? And that's open to whoever wants to do it. Like if you're an RN student, an LPN student, if you're a pre-nursing student, we can make that happen too. Also, hey, there's an ebook that's over there, y'all. An ebook. That link is also in my bio. Hey, this is 100. Let me show y'all. Look, over 700 pages, y'all. Over 700 pages. There's over 200 pages for pharmacology. We talk about management and delegation. There's like 50 questions that are in there for you guys to answer with the answer bank. You know what I'm saying? All kinds of stuff that's in there. So if you guys are curious about anything like that, you check those links out there in my bio. And just a heads up for others, the NCLEX changed, and so has the HESI. Yeah. So the NCLEX, the biggest thing that changed about it is just how the questions are delivered. The content hasn't changed. At all. So essentially, like, it's just the way that the questions are delivered to you, aka closed questions, those matrix questions, aka the bow ties, anticipated versus not anticipated, extended multiple choice, still the select, all that apply, partial credit for those select, all that apply, case studies. Yeah, there's going to be a lot of case studies. They are, because the case studies are meant to essentially give you all the information that you need in order for you to use clinical or critical thinking to make a clinical judgment. All right. Practice, 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 practice. And I'm gonna tell you right now, when I studied for NCLEX, when I used Kaplan, they had case studies. And actually, as a matter of fact, there are a good amount of case studies that are actually inside of the lectures that are in the 7-day NCLEX course. All right. Also, people always ask, why is it 7 days? Because what I realize is that when you go to any type of review for NCLEX, they're usually crammed like within 3 days. So I put it as a self-pace over 7 days. That way it gives you time. It doesn't take away from family. It doesn't take away from the job. You just have to be disciplined to sit down for anywhere from an hour to 3 hours a day to get your learn on. That's all that means. And you do it and you do it over the course of 7 days, right? So you get the logic, the learning, and the strategies and understanding what these questions are asking you over a 7-day period. That's what it means. And it's on demand. And you have, like I said, you have it until you don't want it anymore. You know what I'm saying? So always check. You guys are more than welcome to check that out. Those links are in my bio. Okay. Also, for the 23 people that are in here, coming down the pipeline, if you guys are not aware, is I am creating something, what I like to call, we're going to make something happen in 30 days. Come take a tour with me. So it's like a tour of duty. Like if you guys don't understand, like my military background, been on, like I said, 2 deployments, and come take a tour with me for 30 days. Essentially going to be group coaching. It's only going to be open to 10 people though. So the first 10 people to get it are going to be a part of the group coaching. And we're going to go through NCLEX together, right? You're going to get essentially everything that you would get in the one-on-one, right? So you would get breaking down NCLEX questions. You'll have not a case study. You'll have a study calendar. You'll have a tracker. You'll have a time management tracker. You'll have contact with me. We'll be in a private group with one another. So it's us 10, or us 11 total. So it's 10 of y'all, one of me, where we all have a conversation. Any questions get answered throughout the week. Like stuff like that. And that is kicking off on January 5th. I've already set the time, so it makes me have to do these things. So it's going to be January 5th, but be on the lookout. Be on the lookout. The wait list page is going to be coming up real soon, and I'm going to share that with you guys as well. So, hey, if you guys are interested in that, make sure you guys keep coming to the lives, all right? Make sure you guys keep coming to it, all right? Karim says, nice. Hey, look, that's what I'm saying. I haven't come up with the cost for it yet, but I can tell you right now that if you don't already have the 7-day NCLEX course, that it's going to be included in that if you don't have it. All right. But it'll come in there, but it'll definitely it's more of an intimate setting, right? It's intimate. It'll be me, y'all, what questions y'all have. Y'all want to break down questions together. And the thing about it is, like, everybody bounces off of one another. All right. Give you the guidance that you need. Give you the guidance that you want, right? To push you in the right direction. Remember, I'm that dude who's just gonna, give you that nudge. But you got to remember, the path to conquering the NCLEX begins with you. It's all about you, your mindset. You come in, hey, if you're part of this group and you come into this and you're just like, oh well, if I fail, I fail. I'm gonna be like, all right, cool. I'm gonna need for you to change your thought process, because you're not gonna contaminate the rest of everybody else's thought process. Don't do that, right? Because I've actually said that before, and I had a girl who was near me. She's like, oh no, I can't be near you. And this is when I first took my exam. Okay. So the cost, those will come out. All that information will be laid out on the page when that time comes, and everything that's included with it. But like I said, it's going to be a wait list. It's going to be a wait list because I can't, usually I have 2 to 300 people that'll be in here. I can't do it for everybody, but we're going to trial it in January and see how effective it is for people. See how much it helps. All right. But what other questions do you guys have? I got a few minutes left. For any question that you guys have. Hey, if you guys are new here, welcome. Y'all got me to 21,000 likes, so I appreciate you. We usually do NCLEX questions, right? First thing, give it about 5 minutes, and then we jump straight into the questions. Make sure you guys go over there and check me out on all those social medias. Check out Instagram, check out I have a Facebook page, as well as on X and Thread and YouTube, right? So all these videos that go on with these lives, they're going to go up on YouTube. Okay. So if you missed it, you guys can go over there and check those out for yourself. Okay. But, yeah, that's it for the plugs with me. Any other questions? Any questions? What do you got for me? Anybody see that GTA trailer that was supposed to come out today, but it leaked yesterday? I got any gamers in here? I know I got nurses in here, but I got any gamers in here? What are we thinking? What questions do you guys have? Okay. Well, if nobody has any questions, I think I'm going to call it a night for tonight. Hey, but for tomorrow, we will be here again tomorrow doing these questions. And I can only assume that it's finals week, which is why a bunch of people aren't here. You know what I'm saying? Because, hey, everybody's grinding. We're in December. People are graduating this week, next week, the week after that. So shout out to everybody that's putting in that work, to graduate and get through the semester. All right. So thanks always, man. You are welcome. Hey, as long as you're getting value out of this, I appreciate it. So yeah, make sure you guys keep putting in that work. Those going to do those HESIs, those exit HESIs, semester HESIs. Congratulations to y'all for conquering those. All right. Hey, but last little plug, make sure you guys check those links out in my bio. All right. Also, be good to yourself. Be kind to yourself. You only got one you. Okay. And if you can't take care of you, you cannot take care of nobody else. All right. But hey, until then, I will see everybody unless something changes, but I doubt it. But I will see everybody tomorrow. So